It is my pleasure to introduce the next speaker, Professor Emeritus Edzard Ernst from Exeter University. Professor Ernst qualified as a physician in Germany in 1978, where he also completed his MD and his PhD. Interestingly, he, like many German-trained physicians, received hands-on training in acupuncture, autogenic training, herbalism, homeopathy, massage therapy, and spinal manipulation. I hope the pronunciation is right for all of this. Later, he became professor in physical medicine and rehabilitation at Hanover Medical School and head of the PMR department at the University of Vienna. In 1993, he moved to the UK and became chair in Complementary medicine at the University of Exeter. He has published 48 books and more than 1,000 scientific peer-reviewed articles. His work has been awarded with 14 scientific prizes. His research has focused on the critical evaluation of all aspects of alternative medicine with the aim of providing objective evidence and reliable information. His books include the Oxford Handbook of Complementary Medicine, published by Oxford University Press, and his latest book is Trick or Treatment: Alternative Medicine on Trial, co-authored with the science journalist Simon Singh. This book, written for the lay person, has been translated into over a dozen languages and was voted Science Book of the Year in Germany in 2009. It is an honor to welcome you, Professor Ernst, to the podium at this seminar. The title of Professor Ernst's talk is Alternative Medicine, Fact and Fallacies. Please, Professor Ernst, the floor is yours.
Thank you very much, ladies and gentlemen. I have to start by contradicting this nice introduction. It is my honor to be here. It is my honor to contribute to this event and to help celebrate the professional life of such a splendid person as Professor Magnús Jóhannsson. So it is my honor. Thank you for getting me here. I'm going to talk about facts and fallacies in my field, alternative medicine, which I abbreviate as AM on these slides. Outline of my lecture, I'm going to give you a little bit of background. Much of it has been said already. Then I'm going to go into the facts and fallacies and hopefully arrive at some conclusions. Background about me, you have heard it already. I come from a family of doctors, and as it happened, our family doctor was a homeopath, which familiarized me even as a young boy with homeopathy from the patient point of view. Then I decided to study psychology and didn't like it, and studied medicine, which I did like and even finished. Again, another coincidence, my first job was in what was then the only homeopathic hospital in Germany. And I was fascinated by homeopathy, by clinical medicine. Every young doctor, I'm sure you remember your first patients, is fascinated by his or her first patients. So one has to see that in perspective. But I did learn hands-on a lot of the techniques which we call alternative medicine today. Then a total career change, I became a scientist. I went to London, worked in a research lab in St. George's Hospital, and did a PhD in blood rheology, which has nothing to do at all with alternative medicine. Then my life drew me back into clinical medicine. I became a specialist in rehabilitation medicine, then professor of rehabilitation medicine, first in Hanover, then Vienna. In 1993, I took the chair of complementary medicine, which at the time was the first worldwide in this subject area. We've published enormously and were very productive. And I too have a blog, which I advertise here, and you should visit it. Very interesting discussions there. The background, very briefly, about alternative medicine. As we all know, large proportions of the general populations are using some form of alternative medicine. And if we look at patient populations, for instance, patients with cancer or other chronic conditions, we see that these percentage figures often rise, approaching 100%. In the UK, we spend quite a bit of money, 1.6 billion per year is our estimation, on alternative medicine, and this money comes out of the pocket of the patient, not the National Health Service. Even though it is popular, the most fundamental question about efficacy and safety, for instance, remain unanswered. And there are powerful lobby groups which are pushing alternative medicine, and the media has an enormous appetite for stories about it. Only today I was asked to comment on some film star who used cupping and appeared with a large décolleté, and the cupping marks were all over. And tomorrow, if you read the Daily Mail, you can see my comments about that, which might amuse you. Here are some figures, 1 year prevalence figures in various countries. When I did that slide, I didn't have figures from Iceland, but you can see that the prevalence figures in most countries is quite substantial. That is 1 year prevalence figures in general populations. In Iceland, I dug out some data which seems to indicate that about a third of the Icelandic population uses alternative medicine, and that is confirmed with virtually all the surveys that we have worldwide. It is the female patient, the affluent patient, often the well-educated patient, who is drawn to this type of healthcare. Another figure which indicates what I already said, in patient population that the prevalence figures are higher. This is data from MS patients, and the Icelandic 1 year prevalence figure is 59%. So what is alternative medicine? It is very hard to define, and we could spend many hours, boring hours, trying to define it. To define it, but to me it's an umbrella term for a whole range of treatments which have very little in common, and we often forget that it's also diagnostic techniques that we should be talking about but rarely do talk about. They have little in common other than being outside mainstream medicine, and it really goes from A to Z, from acupuncture to zone therapy. Somebody counted more than 400 different modalities under this umbrella. And here are some of the treatments, and you can see instantly on this slide that many of them are diagnostic by nature as well. One is purely diagnostic, iridology, for instance. People look into the iris and tell you about the liver, which is very strange, to say the least. And you can see that iridology has very little to do with herbalism, and homeopathy has very little to do with massage therapy. So that's the difficulty in defining the subject. But even though it's diverse, there are common features. That's why we have the umbrella term. There are simple, all-encompassing theories, like yin and yang in acupuncture, for instance. There's the emphasis on holism. There's the concept of energy and balance. Put these in inverted commas because they're odd concepts which do not confirm with the use of the word energy in physics, for instance. It is assumed that natural equals safe. The proponents of alternative medicine claim that they're treating the root causes of the disease. They claim that they can cure all diseases. It's a panacea. Acupuncture is being used for virtually every indication that you can imagine. Treatments are highly individualized. The self-healing properties of the body are being emphasized. There's a long tradition of usage. Acupuncture goes back 5,000 years, as we will see in a minute. And as I already indicated, it's private healthcare in most countries. This slide shows you the summary of a systematic review which we recently published, 73 surveys, where people had indicated what they expect when they use alternative medicine. And the slide is ordered in order of priority. They expect less side effects, symptomatic relief. Some patients expect a cure, which is worrying. Some people expect to cope better with their condition, improve quality of life, boost the immune system, prevent disease. That is often forgotten. A lot of alternative medicine is actually claiming to be prevention. A good therapeutic relationship, very important, I believe, because in a way some of these items are criticisms of what is happening in mainstream medicine. If patients want a good therapeutic relationship or holistic treatment, that implies, at least to me, that with their conventional doctor they do not have holistic care or good therapeutic relationship. They want emotional support and they want to take control of their own condition. Enough background, now facts and fallacies. What is a fallacy? My dictionary tells me it's an argument which fails to satisfy the condition of valid inference. That doesn't tell me very much what it really is. To me, a fallacy is some argument that looks plausible, that is commonly believed, but that is neither logical nor true. So, what are the fallacies? There's so many fallacies that I could have chosen from in alternative medicine. I've picked almost at random 7 fallacies which I'm going to discuss here today. The appeal to popularity or authority is one fallacy. Here's the appeal to authority. Prince Charles in my country is one of the most outspoken proponents of everything alternative. And the appeal to popularity is reflected in this slide. The question was asked, I trust homeopathic medicine. Do you agree or not? And you can see that in India, South American countries, a lot of people agree, whereas in Britain we are much more rational, and only in inverted commas 50% of people agree with this. So the fallacious argument here is that many people use this treatment, homeopathy for instance. Most are satisfied with it, otherwise they wouldn't use it. Some even pay out of their own pocket with it. And that's not fallacious, it's true. It's not a fallacy. The conclusion of this is the fallacy. The conclusion that is often drawn is homeopathy is popular, and therefore it must be a good thing. Homeopathy should be made available for all those, for all people, and it should be free of charge. That is the fallacy. The facts, however, look quite different. The facts about homeopathy, homeopathy is based on two main principles. One is the like cures like principle, the other one is the endless dilution of the remedy, which homeopaths call potentiation. Neither of these principles are plausible, therefore the assumption which homeopathy is based on are totally implausible. If we were locked in this room in order to design the most implausible thing in medicine on this planet, we couldn't come up with something that is more implausible than homeopathy. But the proof of the pudding is in the eating, they say in Britain, and the acid test for any treatment is whether it actually works in patients. And that we test in randomized clinical trial, and the most reliable clinical evidence from randomized clinical trial fails to show that homeopathy is effective. So these are the facts against the fallacy. Fallacy number 2: it worked for me, my aunt, my child, my cat, whatever. The argument here is, scientists, you may say what you want, I know it works, I have experienced it on my own body, don't tell me I'm stupid, I know what works. And here's a recent study from Iceland. This was a study, and this is a quote from the publication, to explore the effects of reflexology on pain in women with fibromyalgia. For that aim, the authors studied 6 patients who received weekly reflexology, and the pain, again a quote from the results section, pain started to decrease, and the conclusion, again a quote, reflexology may be helpful to decrease fibromyalgia symptoms. And I'm showing you this. I don't want to insult this piece of research. There are actually dozens of similar, sometimes much larger observational studies that seem to indicate that around 70% experience clinical improvement after receiving this or that alternative treatment. The facts, however, look quite different. A systematic review of reflexology, to remain with this Icelandic example, in our hands, a systematic review of all the 23 randomized clinical trials showed that the methodology was often poor of these trials, and that the high quality studies tended to be negative. Independent replication of even the positive studies were missing, and our conclusion was that the best clinical evidence does not demonstrate convincingly reflexology to be an effective treatment for any medical condition. So again, you see this stark contrast between the fallacy and the fact. But how can it be true that people experience benefit, and nobody doubts that people do experience benefit after reflexology or after homeopathy, and that the evidence, the scientific evidence, is squarely and convincingly negative? There is actually no contradiction in that at all. We need to understand that clinical outcomes are determined by a lot of other factors than the specific effects of the treatment. There are such things as the natural history of the condition. In other words, if I have a common cold and I treat it, it will be gone in a week, and if I don't treat it, it will be gone in 7 days. This is what we call the natural history of the condition. There's the statistical phenomenon called regression towards the mean. If I sow dice and I happen to have 3 6s, chances are that if I throw dice again, I don't have 3 6s. That is regression towards the mean. There's the placebo effect, which we all know about, and there are other phenomena. For instance, social desirability. Patients who we are nice to tend to be nice back. So if we ask them, are you better? They say, yes, doctor. And they may be actually not better at all. So patients will experience improvement or will claim to having improvements even after receiving ineffective treatments. And improvement after an intervention is not the same because as improvement because of the intervention. And the plural of anecdote is not evidence but anecdotes. Fallacy number 3. Placebos help patients. Again, this is true as clinicians. We all know, we all seem to know, even though the scientific data is a bit more complicated, but I think it's true. Placebos do help patients. Again, what is the fallacy is the argument that follows behind that statement. Placebos help patients and should thus be used in clinical routine. So I ask you today, is it okay to use homeopathy, spiritual healing, Bach flower remedies, or any other disproven treatment because some patients perceive benefit from them? Who thinks that is right? Don't be shy. I'm not going to bite. It's not true that nobody thinks it's right. You're just too shy. Usually I get about 50% of hands rising. People feel that this is right. And I, as an ex-clinician, sympathize with them because it's got to be right. All that matters as a clinician is to help the patient. So that is a powerful argument for lay people, a powerful argument for doctors, of course, any healthcare professional, but also for politicians, decision makers. But there are many no's, and I'm going to quickly go through the no's. Placebo effects are notoriously unreliable. They may happen sometimes, but not always. If we are content with achieving placebos, we won't make progress. If we had been content throughout the history of medicine, we would still live in the dark ages of medicine. So it's anti-progress. Placebo treatments usually involve deception. This is an ethical argument. If I tell somebody, take this remedy, there's nothing in it, and the trial data doesn't show it works, but take it nevertheless, then this person won't experience a placebo effect. If I say, take this homeopathic remedy, a lot of people have benefited from it, and the trial data shows encouraging results, I'm actually deceiving that patient. So this deception is unethical. Very often placebos, like homeopathic remedies, prevent effective treatment from taking place. In other words, they're used as true alternatives, replacements for effective treatments, and that is a way to sometimes even shorten your life. Some placebos are not without risk. I'm going to talk about risks in a minute, but some ineffective treatments are clearly not free of risks, of direct risks, and therefore the risk-benefit ratio must be negative. Some placebos promote irrationality. If I believe in spiritual healing energy, if I believe that this energy is being sent from the cosmos through me into the patient, what else am I going to believe? And the most important argument for me, at least, as an ex-clinician and presently as a researcher, we don't need a placebo to convey placebo effects. That sounds almost paradoxical, but it is actually quite logical. If I give any patient suffering from a disease or a symptom a placebo, that patient will benefit from the placebo effect. If I give that patient an effective treatment with empathy, kindness, compassion, that patient will benefit from the placebo effect, of course. But also, that patient will benefit from the specific effect of my treatment. And if I turn this argument around, just giving a placebo, just giving a homeopathic remedy is actually cheating the patient out of something that the patient should have. So that is a powerful argument against it. So let's look at the score. It's 7-1, which to me indicates a clear no. Fallacy number 4. Alternative medicine defies science. That is a very prominent and almost ubiquitous argument in my field of inquiry. Somehow people think that alternative medicine is so special that it cannot be fitted into the straitjacket of reductionist scientists. Here we have two prominent alternative medicine people in Britain. I'm just quoting the second one. Peter Fisher is the Queen's homeopath. And he once wrote that conventional randomized clinical trials are unlikely to capture the possible benefit of homeopathy. I can tell you, I mildly disagree with that. The facts are quite different, and the facts seem to indicate that this is the promotion of a double standard. We all know how a clinical trial is run. A group of patients, ideally patients with the same diagnosis, but not even necessarily so, are divided, possibly at random, but not necessarily so, into two groups. One group receives treatment A, the other one receives treatment B, which could be a placebo, but doesn't have to be a placebo. Then at the end of the treatment period, we compare the results. When I talk about this type of research methodology to complementary practitioners or to students, I usually bring a bottle of wine and say, anybody who tells me about one alternative treatment that cannot be tested in that way will have that bottle of wine. I like my red wine, and I always take it back home. And here's the first ever controlled clinical trial in the history of medicine. And it was a controlled clinical trial of alternative medicine. The date was 1747. The primary investigator was a guy called James Lind, General Surgeon of the British Navy, and the condition was scurvy. Scurvy was a very serious condition that limited the effectiveness of all navies and cost the life of hundreds of thousands of sailors. And he decided to treat two sailors with cider, two sailors with vitriol, two sailors with vinegar, two sailors with seawater, two sailors with a strange concoction, garlic, mustard, radish, etc., and two sailors with oranges and lemon. And we all know the outcome of that. That is the vitamin C story, or the beginning of the vitamin C story. And it truly was a trial of alternative medicine, even seen in the context of the time, 1747, because oranges and lemon were added to that trial as an afterthought. It was truly an alternative. And the sample sizes, two sailors, are ridiculously small, but the effect was so powerful that it became clear after 6 days. The sailors treated with vitamin C, oranges and lemon, did survive, and the others didn't. Today, a lot of people say in alternative medicine we have a vacuum of evidence, we have no evidence. My estimation is that we have about 10,000 clinical trials and about 1,000 systematic reviews. So anybody who tells you there's no evidence is not well informed. Fallacy number 5, appeal to tradition. The argument goes that anything that has survived hundreds of years, like homeopathy, or thousands of years, as acupuncture, for instance, must be good, must be effective, must be safe. Think of bloodletting. Bloodletting was used in all cultures of healthcare throughout the globe for centuries, and it must have killed millions of people and did good to virtually nobody, unless you had polycythemia. Think of acupuncture. This is the leg, by the way, of a guy called, nicknamed Edzard, who was found in the ice near to where I grew up, in the Alpine glaciers, and he was displayed, he was investigated, he was found to be 5,000 years old. And one day, somebody who understood acupuncture investigated him and found points tattooed on his leg, and these points are acupuncture points. So the hypothesis, a little bit tongue-in-cheek, is that the Chinese nicked acupuncture from the Alpine folks. Anyway, acupuncture, as you know, is claimed to be a panacea by the Chinese traditional medicine people, and we did a systematic review of the literature and found that actually unanimous agreement in systematic reviews was only achieved for one single indication, that is neck pain. So it's not a panacea, and traditional use as a panacea doesn't tell us very much. Here's traditional use for herbal remedy, aloe vera, and you can see, starting from the bottom, that in the West Indies it was traditionally used for syphilis prevention, in Taiwan for hepatitis, in South Korea for contraception, Saudi Arabia for piles, etc., etc. So either aloe vera is a true wonder drug, or there's something wrong with the assumption that traditional use tells us much about efficacy. And I can tell you the latter is not true and the former is true. We have looked at aloe vera systematically, and it's not certainly not a wonder drug. Fallacy number 6. Alternative medicine is natural and therefore it must be safe. That is somehow hardwired into human brains. I don't quite know why, but it's hardwired, and it's perpetuated by the press. Yet it's untrue. The facts look quite different. When we started researching in Exeter, we did a large survey, which is this column here. That is our survey data on over 3,000 people, and we found that spinal manipulation causes adverse effects in about 16%, acupuncture in about 12%, etc., etc. The actual, after 20 years of doing the research, the actual figures as we understand them today are listed here. 50%. Every second patient having spinal manipulation will have mild to moderate adverse effects, which only last 1 or 2 days. But in addition, we have serious complications and about 100 deaths reported. These 100 deaths don't sound much when you compare it to conventional medicines, but we know underreporting is probably close to 100%, so it is much. With acupuncture, the figures are actually our initial estimations were spot on. We know now from prospective investigations of more than 20,000 patients that it's between 7 and 11%, again, fatalities do occur. How can you die of acupuncture? Well, quite easily by introducing a needle into a vital organ. That's what happens, into the heart and into the lung. And if the acupuncturist does bilateral acupuncture, which is often done, and punctures both lungs, you're in serious trouble. Herbal medicine, we can't really tell, because it depends on which herbal medicine we're talking about. But my estimation is that at least 1,000 deaths have been reported in the medical literature. And here's some of the issues in relation to herbal medicine, because I know Professor Jóhannsson has an interest in this area. The issues, as I see them, are toxicity of the herbal ingredient. Not everything that nature produces is safe. Think of hemlock, for instance. Then we have interactions between herbs and drugs. Particularly with Asian herbal remedies, we have contamination. For instance, heavy metal contamination is very prominent. Up to 25% has been reported. 25% of all for sale Asian herbal remedies. And adulteration, similar but different. Adulteration means the willful adding of pharmaceuticals into what is sold as a herbal remedy. And here's some examples. Mao-Wang ephedra contains ephedrine, and in this relatively small case series here from cases reported to the FDA, we had 10 fatalities. 10 people died because of Mao-Wang, which was marketed as a slimming aid. Herb-drug interactions, a confusing slide. This is our own publication from drugs, and this is just one single herbal remedy, St. John's wort, which, by the way, is effective, but you have to be careful not to combine it with any of these with these medications, because it usually decreases the plasma level of these medications. And if the therapeutic window of the drug is small, then you create problems. And spinal manipulation. That is a chiropractic maneuver, and that is the one that is particularly implicated here. Rotational movement, sometimes with overextension of the neck. What happens anatomically, you can see the vertebral artery makes a little kink before it goes into the skull, and at rotation the vertebral artery is overextended. That happens with all of us, and if it's severely overextended, and if we have a weakness in this artery, then it just dissects. If it dissects, we have a stroke, and if we have a stroke, we can die. And most importantly, in my view, are the indirect safety issues. If any ineffective treatment is used to replace effective therapy, even the most harmless treatment becomes positively life-threatening. This is indisputable in my view. And here is just one set of data to show this. This is a retrospective chart review of breast cancer patients who were using alternative treatments, truly alternative treatments, as a replacement of real treatment, or were not using it. And you can see that the 5-year survival rate was halved in the case of those patients who were using alternative treatments to replace mainstream oncology medications. My last fallacy, I have depressed you a lot by bringing so much negative evidence. I'm now going to cheer you up a little bit, because I'm telling the truth usually. My wife might have a different opinion about that, but usually on scientific meetings, at least I do tell the truth, and the truth is not encouraging in my field. people have nicknamed me the Quackbuster. And one should be quite proud to be depicted like this in a newspaper like the Times, but the title Quackbuster is inappropriate. I'm not a quackbuster. The facts are quite different. And the facts are such, and my irritation with that title was such that I compiled in one single publication all our positive results. And here they are. These are treatments which, according to our standards, which are the standards of evidence-based medicine, do actually work for those conditions listed here. And this is just the first of 2 slides. And I mentioned St. John's wort before. This is probably the best evidence we have in alternative medicine for mild to moderate depression. It is undoubtedly effective and probably better than conventional antidepressants. So a quackbuster wouldn't publish that sort of thing, and I'm not a quackbuster. It's just too simple. The reason why I get annoyed by it, because the alternative brigade can then say, oh, don't listen to him, he's just a quackbuster. I'm not, I'm just telling you the facts. So, the end is near, let me summarize. Alternative medicine is popular. I think we have all seen the data, and particularly in Iceland, it is like in many other countries, amazingly popular. Proponents of alternative medicine seem to be highly prone to fallacious arguments. This, after 20 years of working in the field, is, to me at least, quite undeniable. Fallacies appear to be logical, but they can be seriously misleading. Fallacies are therefore dangerous. I think that is the important point here. Fallacies can be difficult to correct, that's by definition so, otherwise they wouldn't be fallacies, and the best antidote might be to expose them. And finally, please visit me on my website if you want to insult me. You are in very good company there. Thank you.